Thank you very much, Madam Speaker. This motion should be adopted. It would prevent the bill from upending the very progress we're all counting on for our innovators to develop new vaccines and therapies to confront this killer coronavirus. You see, it simply states the legislation cannot take effect unless the Secretary of Health and Human Services certifies that no provision will adversely impact the research, the development, or the approval of any drug intended to treat or prevent COVID-19. Now, Democrats with a straight face have come to the floor today to move a bill that would do grave damage to medical innovation. The Congressional Budget Office has told us that on many occasions. Upwards of 30 to 100 drugs, depending upon the source, could never make it into the pipeline. Will that be a cure for COVID or a cure for ALS or a cure for cancer? We don't know, and neither do the Democrats bringing it. But we do know the independent analyses show we will not see a lot of new medicines. So let's make sure one of those new medicines is not the cure to COVID or a treatment to save lives for people who are on ventilators. That's what our motion to recommit says is, before you move forward with a known innovation killer, let's at least exclude treatments and cures for COVID-19. Our communities are being ravaged. We all know these stories. We all share them with each other about incredible damage done to lungs and organs and lives as a result of COVID-19. In the wake of this public health crisis, medical innovators have worked at an unprecedented speed to develop safe and effective products so we can safely begin to open our country back up and eventually return to normal lives. We've seen public-private partnerships to agree never seen before. Private companies are joining forces with competitors, government agencies, and nonprofits, and they've taken on substantial financial risk in order to bring safe and effective vaccines and treatments to patients as quickly as possible. But now, Democrats, with passage of this bill, want to gut innovation in America. California Life Sciences tells us the provisions of this bill that were included in H.R. 3 could result in 88,000 innovation tech jobs, R&D jobs, going away from America to somewhere else. That's the price of this bill. We know House Democrats voted to impose these dangerous price controls with passage of H.R. 3. We also know that one of the side benefits, shall we say, of adopting socialized medicine is you don't get access to new medicines when they do become available in as timely a manner as you do here. Compared to the U.S. and Australia, it takes an average of 19 months longer for medicines to become available to patients. Canada, it's up to 14 months longer. United Kingdom, 11 months longer. Are those cures to cancer, those new medicines on the market, revolutionary sort of new innovations we all want. So all we're asking for here is before your bill becomes law, and by the way, the administration said they'll recommend a veto, before it moves through the path, let's at least make sure that an unintended but dangerous consequence of this bill does not take effect. And that is, let's make sure that it will not inhibit research and innovation for a treatment or cure to COVID-19. That's what our motion asks for, and I urge a yes vote on the motion to recommit, and I yield back the balance of my time.